Good morning and welcome everybody. I'm Dr. Phil Wood. I'm the Chief Medical Officer here at Leeds Teaching Hospitals and I'm the Chair of our Hospitals of the Future Board. I'd like to welcome you to this market event for our fantastic hospital development project, which we call Hospitals of the Future. We had, of course, hoped to meet you in person, but the current COVID situation means that we're having to do this in a different way. And this meeting will be supplemented by further materials on our website. We really hope it'll give you as much information as you need. Before we begin, I do just need to make you aware that the event is being recorded and to let you know that you can pose questions during the event in a private mode, which we'll endeavour to answer in the next few days. So today we want to share with you why we are so excited about Hospitals of the Future project and what a difference it will make to the way our clinicians and staff provide patient care. It's a unique, once-in-a-generation, significant hospital development opportunity that will have far-reaching benefits for the people of Leeds and the staff of Leeds Teaching Hospitals NHS Trust, but also for the wider region in Yorkshire, Humber and in beyond. So we've got a packed programme this morning. It's an opportunity for you to hear some of our senior leaders who are driving forward the work on the Hospitals of the Future project, to hear about their ambitions for this and the benefits it will bring, the programme and first-hand experiences and views on what's needed in the new hospitals from our clinicians, along with our patients who have been working to understand what the key design and function of these hospitals needs to look like to deliver optimal patient care. Obviously, we're doing an hour's event. It can only give you a flavour of the fantastic work of the Trust and the scale of our ambition. There is more information on the Trust and the Hospitals of the Future programme, including the design brief and the procurement process on the Leeds Teaching Hospitals website. So finally, a reminder, you'll have a Q&A tab on your toolbar. If you click that, you can post private questions to us as a panel, which obviously we can take away and get back to you with answers over the next few days. So that's it from me. It just remains for me to begin the event now by introducing our chair, Dame Linda Pollard, who is going to talk about the impact of our new hospitals for Leeds and beyond. Thank you, Linda.
Good morning, everyone, and thank you, Phil, for opening this market event for our exceptional Hospitals of the Future project. We're really pleased that you could join us for what is truly a unique development opportunity. I probably don't need to tell you how rare and prestigious this opportunity is. It's the chance to design and build not one, but two hospitals. The bespoke children's hospital will be a first for Leeds, in the heart of a northern powerhouse city. And for those who may not know Leeds, it's one of the most significant cities and one of the most important economies in the UK. We are the largest city for financial and knowledge-based industries outside of London. We are known as a city for healthcare and innovation, with key strengths in health tech and digital health. In Leeds and the Leeds Teaching Hospitals, we are a trailblazer. This hospital development, one of 6 awarded government funding in the first wave of the Health Infrastructure Plan, we have planning permission and we are the first to go to market. We are ready, and what we have to say, are you? So we want to work with bold, talented and innovative partners who share our drive to make this happen. This is a once-in-a-generation opportunity to transform healthcare for the patients of Leeds, Yorkshire region and way beyond. We want to design and build bespoke clinical environments that deliver what really matters to our patients, staff, in safe, responsive healthcare that harnesses the potential of digital advances, new technologies and treatments, research and innovation. It's an ambition that plays to our key strengths as a world-leading healthcare provider. For example, we are known for our specialist services, and just two to mention this morning, these include cardiac and neuro services. And these hospitals and new hospitals will enable us to expand our critical care services to offer more specialist patient care. We are known for our clinical research, and just a few stats here to give you. The National Institute for Health Research released in 2019 a stat that placed us 4th in the UK for recruitment to health studies, 21,000 people in that year. We opened a brand new clinical research facility at St James's in February this year. We are the first in the UK for recruitment to the COVID-19 research registry and one of the sites running phase 3 vaccine trials. We build strong partnerships, including with the private sector and businesses, to drive innovation. For example, we have digitised our pathology services, and we work with industry partners, and in that particular case, Leica Biosystems. So it's no surprise that Hospitals of the Future has attracted the interest and support of a number of key stakeholders. And this is hugely important because they include at government level. In the last year alone, I've hosted visits from the Prime Minister, the Minister of State for Health, the Chancellor of the Exchequer, the Northern Powerhouse and Local Growth Minister, needless to say, all our MPs, and many other national and local government representatives. We've had visits from across the health and social care sector, and many of our partners, which include the universities here in Leeds, who have always given us their full support, and needless to say, the local authority. From research bodies, including the Academic Health Science Network, established by NHS England to spread innovation at pace and scale. Of course, we include our clinicians, other staff members of LTHT, and needless to say, our patients. For Leeds and the wider region, the hospital development is also a pivotal moment in our city, Leeds. It will release about 5 hectares of estate on the Leeds General Infirmary site, and this will support the development of an innovation district for Leeds. This is a strategic collaboration between the Trust, the Leeds Universities and the City Council, focused on regeneration, driving innovation in healthcare delivery, leading to economic and social value. It will capitalise on our regional strengths in healthcare across the Leeds City region and drive future prosperity and improved healthcare outcomes. It will create a world-class hub with a focus on healthcare talent, industry partners, research and training. It will deliver 3.3 billion gross value added benefit. It will create 3,500 jobs for Leeds and the wider region. So it really is a project that will make a dramatic impact, not only on healthcare for patients in Leeds and the region, but also the regional economy and UK research and innovation. This is an exciting project and an exciting time to be involved, but let's be bold and work together to make this happen. We want bold partners who aspire like us to deliver the best. We need partners who share our vision and the legacy that this will leave. We are on a journey of success. So I need to ask you, do you want to share that success? Thank you.
Thank you very much, Linda, for that inspiring summary of our ambition. I'd now like to hand over to Julian Hartley, who's the Chief Executive of Leeds Teaching Hospitals NHS Trust, to give you an overview of the Trust. Thank you, Julian.
Good morning, everyone. Thank you so much for joining us. Hello, my name is Julian Hartley. I'm Chief Executive here at Leeds Teaching Hospitals. And I want to underline the importance of this opportunity for all of us. You'd be working with one of the biggest NHS trusts in the UK, with a turnover of around 1.4 billion, employing 19,000 staff and serving the population across the whole of West Yorkshire and the north of England. And of course, it's really, really important to us to partner with colleagues who share our ambition, but who can also be confident in the fact that as a trust, we've seen significant improvements in our service delivery and financial performance over the last few years. And certainly over the last 3 years, we've delivered a surplus, financial stability, and we're in a strong position to ensure that we have a successful, stable and sustainable financial foundation on which to support this major capital development. And the importance of this to us can't be overstated in the context of the journey that we've been on over the last 7 years as a trust, where we've really turned around our clinical quality and performance and financial sustainability. But all of that is underpinned by what we call the Leeds Way. The Leeds Way is our culture. It's all about deep employee engagement. It's all about ensuring that every colleague that works within the trust is clear about their role and purpose and how it contributes to our overall ambition. And the impact of the Leeds Way is hard to overstate. And partners working with us will find you're working with a team of people with great commitment, teamwork, endeavour, and a real drive and passion for delivering the highest quality of care. And you'll hear in a moment from some of our key clinicians. And as a trust, we work very, very much through our clinical leaders to ensure that the quality of care we're delivering to our patients is exceptional. So in terms of this development, I think it's really important to say that it's probably no overstatement to say it's the biggest investment in hospitals in the city since 1868. And historians among you will know that the Leeds General Infirmary was founded and built in 1868 by Gilbert Scott, the architect, with some help from Florence Nightingale. But of course, that 19th century magnificent edifice is sadly no longer appropriate for high quality care and specialist treatment. And the kind of specialist services that Linda was describing are ones which need world-class 21st century environments. So we're incredibly excited to have been given the green light for that £600 million investment and development in a new wing for the LGI, which will help support our specialist services, critical care, neurosciences, cardiovascular, all those key services we provide, and a fantastic new children's hospital for the city and the region. and indeed, in addition, the centralisation of maternity services across the city to provide one of the biggest maternity units in the UK. So this really is a epoch-making opportunity, and one that we're very keen to engage widely on. We've already started to involve our partners, our patients, and our young people who are already coming up with great ideas for what they'd like to see within the new Children's Hospital. And it's so important for us as an organisation, for all of our staff, to work with colleagues who share our goals and ambition, and to make sure that we do something really, without overstating this, special and legendary for Leeds and for the region and for all of our patients. So we're really looking forward to your interest. Thank you for joining us this morning, and you're going to hear more about specifics of the scheme and get a real feel for what that could mean in terms of how you could work with us to take that forward. Thank you very much.
Thank you very much, Julian. I'd like now to move us on and introduce Mike Bacon, who is Programme Director for Building the Leeds Way, who will give you more detail about the programme and the timeline. Thank you, Mike.
Thank you, Phil, and good morning, everyone. Very pleased to take this opportunity this morning to introduce you to the Trust's Hospitals of the Future project, but also to signpost you to the wealth of information and briefing documentation that we have posted on our website. During the next 10 minutes, I'll hopefully provide a very brief overview of the scheme and a clear message as to why we believe you should become involved with this exciting opportunity at Leeds. I'll look to briefly cover an overview of our key objectives, the characteristics of our site, and very much linking with the point that Julian's made earlier around the historical context, the key focus for design, and also to highlight our planned procurement and delivery strategy, and ultimately to provide you with the necessary confidence in our scheme at Leeds. In terms of our objectives and our proposals, these have been developed over a significant period of time and through a wide programme of stakeholder engagement. And that engagement has been targeted at both our current, but more importantly, what are our growing future challenges. Those challenges have been amplified through our business case investment objectives, and they seek to focus on a number of key themes, namely high quality specialist services, the patient experience, and the patient experience is a key theme that will run throughout all of our design briefing documentation. Clinical functionality and future flexibility, and again, future flexibility is a massive important theme for us, as it will be for all NHS trusts. Financial sustainability, the staff experience and well-being, and as highlighted by Linda in the opening remarks, about economic regeneration. The architectural design brief that we have made available and will make available in further detail highlights the context of our site and the vacated grade 1 and grade 2 listed buildings referenced by Julian. These are clearly no longer fit for purpose. The design proposals we are seeking must respect the local surrounding context of which our unique hospitals sit, but also address the ambition that we want to have to deliver something very different in Leeds. Our design briefing documentation is being informed through strong engagement, and that is a principle that we want any design team and any contractor to fully embed in the work they do with us going forwards. We believe our design brief and the information we've made available presents a very rare and challenging but yet exciting opportunity to design both a new adults and children's hospital in the heart of Leeds city centre. The new healthcare facilities are characterised by key elements, namely a children's hospital, as well as a new maternity hospital. But in addition to that, there are a number of critical acute specialist areas, be that imaging, theatres, outpatients, therapies, and other real critical important aspects that form part of our scheme. The opportunity proposes the development of new healthcare facilities, which are estimated to be in the region of 94,000 square metres, and that will be cited on what will be provided to the market as a cleared site. Our proposals currently do provide for some simple connections to the Jubilee wing, and the primary purpose of that is to address our future flexibility ambitions, but also to ensure that we provide a fully integrated hospital site. We will be aware that most people will have accessed and seen our outline planning consent, as that's been widely publicised and information widely available on the Leeds City Council's planning website. We recognise that this is a significant milestone, and one which we believe hopefully provides you with considerable confidence about the work we've completed to date. Whilst today's event is very much about looking forward and the launch of our process to procure a design and build team, we've actually made fantastic progress on the back of having secured that outline planning consent. Work has commenced on already making the site ready, and for those of you who are local or know the site well, you'll be very familiar that we've recently erected site hoarding around the site to be cleared, and very soon there'll be a very visual acknowledgement of those demolition works taking place, and with those works planned to be completed by August 21. As mentioned by Julian, design and innovation is really important to us. The very title of our project, Hospitals of the Future, reflects our ambition to step beyond what we see as traditional hospital design. We want to create something different and to place ourselves as a HIP1 and NHS exemplar. To achieve this, we are seeking innovation from design and contracting teams with a focus on the clinical vision, and very much focused again around the patient and staff experience and robust clinical design, drawing out the importance of flexibility. Sustainability and net zero carbon is another critical target for us. The digital hospital, and also considering design and construction efficiency. And what we have developed over the months since October 2019 is a suite of design briefing documents that address those 4 elements. You will hear shortly from clinical colleagues around the clinical vision, so I will not address that aspect, but I will like to just take a couple of minutes just to talk about the other 3. In terms of sustainability, the Trust and our scheme is very much committed to maximising the opportunities to deliver a sustainable and net zero carbon solution within the affordability constraints of our scheme. We have defined our ambition within a comprehensive suite of design briefing documents that namely focus on net zero and whole life carbon, energy efficiency and reducing energy consumption, achieving BREEAM Excellent, but also taking us to new fields and new areas, and we want to be one of the first trusts in the UK to achieve accreditation to the WELL Building Standard. In terms of digital hospital, we're committed to that vision, and I've structured a comprehensive design brief into 5 strategic themes. These being patient and staff experience, again, another key theme that flows throughout all of our design briefing documentation, core infrastructure, smart buildings, and how do our buildings in the future help us deliver our day-to-day clinical duties, digital devices, and digital information systems. These are explained in further detail by Andy Williams as our digital workstream lead for the programme, as set out within, and also set out within our comprehensive digital design brief. In terms of construction efficiency, we recognise the need and benefit for the early consideration of matters such as designing for manufacture and assembly and modern methods of construction. And we believe that considered early within our process, we see these as significant opportunities to maximise value to our programme and budget, but without the compromise of quality. We want to adopt a practical based approach that's guided by, again, another robust design brief around these aspects, and seek to focus on matters from standardisation to approaches to specification, kit of parts, materials and manufacturing. In terms of programme, our robust governance arrangements and experienced delivery team have ensured that since October and the announcement of the HIP1 programme, the Trust has achieved, particularly ahead of plan, its key milestones for 2020. And these are outlined further in detail on our website. Critically, this year, we've achieved submission and approval of our outline business case. We've completed and secured approval of the outcome of public consultation on the centralisation of maternity and neonatal services. We've designed, planned, procured and commenced a very complex programme of enabling works at the LGI site, and we've completed preparatory work to bring us to the position we're in today, ready to commence a procurement for a design and contracting team. However, going forward, and whilst we have a robust 5-year plan, we want further market innovation and challenge to be brought to this programme, and to see how further efficiencies can be embedded within that programme, to see how we can deliver elements early whilst maintaining quality and acceptable risk profiles. Finally, just like to explain a little bit about our planned procurement and delivery strategy, which has been informed through our discussions with the Department of Health and through market engagement. So during the next 4 to 6 months, we will aim to procure a number of specialist design roles and a building contractor. However, our initial focus is on the procurement of a design team to accelerate that process to commence the design work. In parallel with this process, we will appoint a building contractor to work alongside the Trust and the design team, whilst the design team develop a REBA Stage 2 design. At the conclusion of REBA Stage 2, our plan is very much focused around novating that design team to the contractor, who will then take the lead under a design and build principle through to a guaranteed maximum price and a full business case and signing of a contract. There's further information on our website provided about our procurement and delivery strategy and the specific roles that we are going to procure going forwards. I hope that provides valuable context to some of the information we've presented on our website and the information that we will continue to upload over the coming months and make available to the market as we proceed through our design competition. And both I and the delivery team very much look forward to working with you formally going forwards. And I will now hand back to Phil to introduce colleagues and the clinical section.
Thank you very much, Mike, for that really helpful overview. So as we heard earlier from Julian, as a trust, it's really important to us that clinical leadership is centre stage in terms of how we deliver our services. And so it's fundamentally important to us that the design of these new hospitals is clinically led and based around patient need. The next couple of presentations are an opportunity to hear from clinicians themselves about what they need in the new hospitals to help them deliver world-class responsive healthcare. Firstly, I'd like to introduce Dr. Mike Richards, who is the Clinical Director of Leeds Children's Hospital, to tell you more about the fantastic work done here and the opportunity of a bespoke hospital for children. Over to you. Thank you, Mike.
Thank you, Phil. Good morning. I'm really pleased to talk to you about Leeds Children's Hospital, one of the largest and most complex children's hospitals in the UK. We have a highly committed workforce of over 1,300 staff. We provide care to almost 200,000 attendances annually, in excess of 13,000 inpatient stays and 10,000 surgical procedures each year. So we are big and we are busy. We are also comprehensive. We provide a virtually unmatched breadth of clinical services, starting from before birth, working with our maternity partners, passing through one of the largest neonatal units in the country, and onwards until young people transition to our adult services at ages of 16 to 18 years. But our congenital cardiac services continues to care for people until old age. And the key fact is that nearly all of these services are delivered under one roof. But being comprehensive matters to individual patients too. It means, for instance, a baby who may have a heart, a liver and kidney disorder will be born and receive all his or her care in our hospital without moving elsewhere. This delivers safer care and enhanced patient and family experience. And this combination of services is virtually unique in the UK. We're also collaborative. We work closely with our outstanding children's services in Leeds City Council, with primary care and our regional provider partners. So we are proud of what we do, but we are ambitious to do more, to achieve world-leading quality of clinical outcomes, parent, family and staff experience by using cutting-edge efficient processes and clinical and digital pathways. And we want you to be part of this exciting journey. So why partner this project? We have been really careful to listen to the views of our stakeholders. There has been extensive clinical engagement. I have been party to passionate discussions involving all clinical professionals, both medical, nursing and allied professional staff, which has resulted in a clear, agreed planning brief with clinical sign-off. Our partner organisations in Leeds, hospitals across the region, the City Council, universities have all been briefed and are enthusiastic supporters of the Hospitals of the Future project. And crucially, we have sought views from children and their families. For instance, through Zoom meetings, we've invited children to participate in creative design competitions, and they've asked for a calm, colourful, yet happy and open environment, which is in a way a second home from them, rather than being a frightening hospital environment. So we and all our partners and stakeholders are clear about what we want. Now, we want your imagination and innovation to partner our journey. We want together to create a flagship hospital that encompasses the passion to deliver world-class, patient-centred and efficient care to our children and young people. And what better witness to that commitment to this precious patient group can there be than to deliver an iconic building in the heart of the great city of Leeds? This is truly a once-in-a-lifetime opportunity. Please join us. Thank you, Phil.
Thank you very much, Mike, for that. Really exciting vision for the children and young people of the city and the region. You're now going to hear from Dr. Kelly Cohen, who is our Clinical Director for Women's Services at the Trust, on how we will be bringing together maternity and neonatal services in the new development. Thank you, Kelly.
Thank you, Phil, and thank you, Mike, for that introduction. It's a really important point that Mike's made about the fact that many of our most complex families start their journey in Leeds maternity and neonatal unit, because we're looking at a huge opportunity here to design a seamlessly integrated patient and family journey from pregnancy through birth and then into the Children's Hospital, and we are just hugely excited about it. I think it's helpful for us to have an overview of the size and scope of our maternity and neonatal unit in Leeds. In 2019-20, we delivered around 9,800 babies, so it's one of the largest units in the UK. And our mothers were cared for by some 500 hospital and community midwives, 20 specialist obstetricians and almost 60 training grade doctors who performed around 2,500 caesarean sections and around 1,500 forceps deliveries. It's a huge activity set. Our neonatal colleagues receive about 1,600 newborn babies for specialist life-saving care, and around 1 in 3 of those babies are transferred in from outside of Leeds for that specialist care that's located with us. And our catchment area covers around 8 million people from across Yorkshire and Humber, down to the Midlands and up to the whole north of England, as we're the regional referral unit for fetal abnormalities, for congenital heart disease, for neurosurgery, liver and kidney transplants, and many other rare conditions which mums have and then become pregnant. Leeds General Infirmary is one of only 5 centres in the UK with co-location of complex neonatal services, paediatric surgery and cardiac surgery. And our mums and babies really are amongst the most complex in the country. And our main challenge at the moment is that we are split across 2 sites, and we have birthing and neonatal facilities in 2 hospitals located 2 miles apart. And my teams do an excellent job delivering around 5,000 babies on both sites with the same amount of inpatient and outpatient footprint. But you can see that there are a number of problems potentially related to that. And despite many soft reconfigurations to reduce our capacity and demand mismatch, we still transfer at least one baby or sick, or one baby or mum, usually sick, across the city every working day so that they can access the right care. The small neonatal unit that we have at St James's to support our births is isolated from the rest of the children's hospital, and that creates risks that we have to manage at the moment. And so you can see that the opportunity to centralise all of our services together will be absolutely transformative for the women, for the families, and for our staff. And this must not be an ordinary, vanilla, off-the-shelf maternity and neonatal unit, because our patients and our expert teams expect and deserve more than that. This will be the largest single-site maternity unit that's ever been built in the United Kingdom. Every day, 26 new families will be created. Sometimes, sadly, the worst day of people's lives, but usually the happiest day. And this is a huge responsibility that we're taking on together. Our vision is really clear. We want to give outstanding care in an inspirational environment that connects our teams together and puts patients at the centre and in control of their own care. And this building really needs to help us to do that. It needs to soothe us, to feed us continuous streams of digital information, and to work with us to keep our patients safe. So how did we approach the design brief? Well, first of all, as Mike did for the Children's Hospital, we identified the key stakeholders who truly understood our vision and had experienced our strengths and also our challenges. And we delivered a hugely successful public consultation earlier this year, which was a statutory requirement. And we had over 1,500 responses to our online surveys, to drop-in events, to radio and press releases. We really focused on hard to reach and minority groups because accessibility is hugely, hugely important for these vulnerable groups. And we've really challenged our staff over the last 2 years to take apart what they do and put it back together again, using Leeds improvement method and the Leeds way to refine the key clinical pathways that we know will make a massive difference when we centralise. Because we know what we want, and you need clarity from us, and we know that we need a high-risk birth unit that's suitable for high volumes of tertiary care and expertise. We also need a low-risk birth unit with a really natural aesthetic, a soothing place for natural and low-risk mums. We need an assessment area that will be suitable for 20,000 triage episodes every year. And we need zones for critical pathways such as induction of labour and elective caesarean sections. We want flexible rooms designed to deliver family integrated care, not just a camp bed in the corner, but truly family-centred environments. And we need an outpatient suite that's designed to deliver our digital vision. We have a local and regional responsibility, and we want an air traffic control hub for the highest risk mothers and babies across our entire catchment area. And that space also needs to deliver around 50,000 ultrasound scans in pregnancy every year. So it is no mean feat. And we've used all of this feedback to really crystallise the clinical problems that we need your help to solve. We have very high volumes of patients and really large clinical areas. How do you design the flows for safety, efficiency and capacity while still capturing that essence of patient's experience? Our clinical areas at the moment aren't family friendly. We separate parents from babies when we really need them to be together the most. And we have together a fundamental conflict to resolve, that pregnancy is not an illness, but joy and despair coexist, sadly, all too often separated by just a curtain. And how will you design an environment that allows a mother to be cocooned in a safe space, empowering her to have the natural birth that she wants, yet simultaneously provide us with an immediate ability to provide life-saving acute care, potentially on a different floor of the hospital? It's a huge, huge ask. And I hope that it's clear that we know what we want, and we're looking for challenge and partnership from our design partners. We bring a really clear clinical vision and specialist expertise, and we have really strong stakeholder links already in place. And we're really looking forwards to the next phase of this journey and to looking at your outstanding designs. Thank you.
Thank you very much, Kelly, for that fantastic overview. I'd now like to hand us back to Julian briefly to set some of the context of the challenging year we've had with the COVID-19 pandemic and the lessons we have learned for that, which will help us with our hospitals of the future. Thank you, Julian.
Thank you, Phil. Colleagues, delegates, everyone on this call, I'm sure you'd agree with me that this has been a year like no other so far. And of course, a huge part of the response as a nation has fallen to the National Health Service. And we have been very much a key part of that here in Leeds Teaching Hospitals. And our teams have made extraordinary efforts to respond during the first wave. And now, of course, as we are well and truly in the second wave of the virus that sweeps particularly across the north, we're very much activated and responding to that. I think it's important to say in the context of this work that despite some of those challenges, we have used this as an opportunity for learning. So there's been huge innovation and learning over a short space of time, particularly in relation to the use of digital, the use of telemedicine, virtual care, and that's a feature that I'm sure will stay with us, and it is one that we want to use and develop during the course of the development of hospitals of the future. And that innovation, particularly using digital technologies and virtual care environments, is something that we're very keen to develop and explore with you as part of our work as we plan, develop and build our new hospitals. And there's a hugely important connectivity here with our communities. COVID has shone a light very much on inequalities across our communities and the importance of our clinical services responding to those and making sure that the Children's Hospital and the LGI development are part of a wider response, not just within an acute hospital setting, but very much connected to the wider community across Leeds and the region. Also here in Leeds, we have a very specific approach to improvement. We call it the Leeds Improvement Method, and it has its roots in the Toyota production system. And I'm sure many of you are familiar with that, but it's really about how we deliver safe care, reliable care, high quality care by reducing waste, inefficiency, duplication, and making sure that safety is paramount and that we focus on what adds value to our patients and involve frontline teams in that improvement. So we're very much looking forward to partnering with colleagues who share that approach, who share that philosophy, and that's something that we hold dear along with the Leeds way, our culture and our way of working. And finally, just to say that throughout this, despite the challenges COVID has given us, we've continued to make real progress unhindered on the development of this programme. And it is no accident that we're the leading one of the 6 in the first wave of HIP. We're the furthest ahead, and we want to make sure that we're blazing a trail for others. So there's an opportunity, and national colleagues and national leaders are very keen to make sure that the learning that we establish, that the path that we set is adopted and used by the other schemes that are following us. And particularly in relation to one of the questions in the chat about Project Speed, we're very much stitched into that, and we're helping, we're working with national partners to make sure that we're framing that approach for the rest of the NHS to follow. So there's an opportunity here for partners that join us to really set some of the benchmarks and templates for what is a major capital investment across the NHS generally, with the 40 new hospitals, but particularly the 6 of us in the first wave. And of those 6, obviously here in Leeds, we're at the front of that. So thank you for the opportunity to speak to you today. I'm sorry we couldn't meet face to face for obvious reasons, but that's not a barrier for us to make progress. And I'm sure you in all your businesses are having to work in different ways, but continuing to work to make things happen. So thank you, and very much looking forward to getting to know many of you better over the course of the next few weeks and months. Back to you, Phil.
Thank you. Thank you very much, Julian. So that wraps up our Hospitals of the Future market event today. I hope you've had the opportunity to understand just how passionate we are about this hospital design and build project, and what an amazing opportunity it will be to work with us to make it a reality. We're really looking forward to bringing our ambition for clinicians and patients to life, and in providing hospital buildings that offer forward-thinking care based on the needs of our patients, but also that our buildings are real quality that will be a landmark for the city of Leeds and the region and stand the test of time. Thank you for posting questions in the chat, and we'll try to answer those as quickly as possible in the next few days. Please do visit our website for more information. As Mike Bacon said, we're putting new information on that all the time. Send more questions if you would like, but all now it remains for me to thank everyone who's spoken today. Thank you very much for attending the event. Goodbye, and we look forward to working with you. Thank you.